Good morning and welcome. My name is Lani DeHeck, and I am with the BC Nurses Union. I am the Safety, Ability, and Wellness Specialist, and I'm really so pleased to be able to be here today to present with you and have this conversation around menopause in the workplace from a nurse's experience to workforce solutions. I am presenting today along with my colleague, Marie Norton, who is behind the scenes helping me out, and the support of our Work Wellness Institute team. I'm very pleased that this is able to be possible through the support of our research partner, which was the Menopause Foundation of Canada, and our education partner, the Work Wellness Institute. I'm grateful for their resources of time and the use of their platform, like I said, for this important conversation. So I wish to acknowledge that I have the privilege to live, work, play, and learn on the traditional, ancestral, and unceded territory of the Coast Salish speaking peoples. The BCNU head office is located on the lands in our Burnaby office, and as well as where I live. Uh, Before we continue, I just wanted to give you a little bit about some background here and some logistics here. You should be able to see and hear the presentation through your computer or simply hear us through the conference call if you've dialed in. We do ask that participants stay muted through the presentation. I will also point you to the toolbar, normally located at the bottom of the screen. You should see CC function option to enable closed caption if needed, and it's available in both English and French. There is two ways to communicate with us for the presentation, both of which are found again at the bottom of your screen with the tool functions menu. If you're experiencing any technical difficulties, please share a thought or comment for the whole group today. Please use the chat function. Should you experience technical difficulties, you can contact the email at admin@workwellnessinstitute.org and they can get you some support. We'll have a dedicated Q&A at the end for the presentation, but you are welcome to put your questions into the Q&A as they come to your mind. And again, this function allows you to ask anonymously as well as privately to the administrators for today by using the Q&A function versus the chat box. We will be using some polls today, so and again, those are anonymous, so please participate as we go along. And here we are at our first poll. So we'd like to start with this session with a quick poll to see who is here with joining me today. So what I'd like to know is, what is your primary role in the workplace? Are you a people manager, human resources, disability management, a frontline worker? There's a choice of 4 there, so find one that fits best for you. Oh, and we'll just give a minute for that to come in. Oh. Okay, what do we have here? Okay, so we have quite a few folks here who are organizational support, so human resources, disability management, frontline workers, manager, and someone from the senior leadership. Fantastic, because it actually does take a whole team and a community to be able to work through these challenges. So this is fantastic. And there's a role for all of us here in this conversation. So menopause remains a taboo subject. I know, after all these years. This is a universal experience for half the population, and yet it is something that we don't talk about openly or freely, unless, it's often the butt of jokes. We've all seen the ones around, the fans or hot flashes and things, but that doesn't actually help move the conversation forward. 10 million women in Canada are over the age of 40. So that's more than 25% of the population. And that means that's a lot of women who could be experiencing some stage of menopause and menopausal symptoms. So perimenopause, menopause, and postmenopause. It's a spectrum and a continuum. And it is highly individual, and people will have their own experience. But when we talk about menopause, menopause is actually one day. Menopause is 1 year after the last period. That is the day you have menopause. But you have perimenopause, which is before, and you have postmenopause, which is after that date. And it can, like I say, ride the spectrum and ebb and flow. And I can tell you that from my own experience. So, a little bit about today and where we're going to go in this conversation. So, a little bit more about me. I'm a registered nurse and a disability management professional. I've worked in healthcare industry my entire career, with the last half really focusing around health and wellness. I've always had a passion towards my coworker and helping workers so that they are healthy and able to really support the patients, that we were caring for. Through this work and the disability management work, I met Janet Coe from the the Menopause Foundation of Canada, and had her present a webinar to the disability management practitioners of Canada. We were facilitating that conversation, and during the webinar, I just had this moment of realization that in all my years of healthcare, which is primarily female industry, we have never had this conversation. And I just was stunned. And so I thought, there is opportunity here to really grow and to explore this further, and we shouldn't be this shouldn't be taboo. This shouldn't be a secret that we work through or that we're talking about in the break room, but not actually helping each other out with. We are a tremendous resource as women and colleagues, and we can make a lot of change and impact through this. So that's how this came to be. So following that webinar, I invited the Menopause Foundation and collaborated with the BC Nurses Union, our research department, and we did this project. So today I'm going to walk you through some of the background work that the Menopause Foundation did, some of their initial reports around menopause in the workplace in Canada, and give you some of the scope of it. And then we're going to go into the research that the nurses did with our membership. And through that, looking at what are some of the critical pieces that were identified in the workplace, but also what are some of the solutions? And going forward, what are some of the solutions and how we can take this forward? So while there is my background is, like I said, healthcare, and the work here is healthcare, I invite all of you to think about other industries as well, and whatever industry you're working in. Whether it's construction, whether it's first responders, police, fire, retail, whoever, your education, a lot of parallels. Uh, think about your industry, your workplaces, and you know, see what's resonating for you along this. So it's not limited to nursing and healthcare. This is much broader than that. So let's get into this. Some understanding what menopause. So as I mentioned, you have a continuum of health along the way. And I do want to say right off the bat, really clearly, menopause is not a disability. Menopause symptoms can be disabling. Okay, so there is a very clear difference. This is not disability, but the symptoms can be disabling for some people, not all, but for many people. Okay, um, most women enter menopause around 45 to 55. The average age is 51, but a significant number will enter before the age of 40. I was one of those, and even some younger than that. Okay. Menopause is the experience prompted by the changing hormone levels and affects anyone who has periods. Like I say, typically between that 45 to 55. It can happen naturally. It can happen because of a surgical intervention or a genetic reason. Either way, the symptoms of menopause and perimenopause can have a big impact on a person's life, their relationship, and their career. So 95% of those surveyed, when they did the Menopause in Canada study, experienced symptoms of about 7 different symptoms. 3/4 of the interviewees said the symptoms interfered with their daily lives. So if you take a look at this, you might be surprised to say, wait, I didn't know that that was connected to menopause. You might be looking and saying, yep, got that one, or I had no idea. Um, so, like I said, some of them are more the butt of jokes, like the hot flashes, the night sweats, and they are not funny at all. Mood swings, mental health, cardiac, headaches, migraines, anxiety, um, skin changes to your tissues, your gum tissues, vaginal tissues, dryness, incontinence, urinary tract infections, all of these things. Estrogen and hormones go through the entire body and every system. And so it can impact everywhere. And I think we don't often think about that. So I have another question for you. Has this topic impacted you personally or professionally? There's your choice, personally, professionally, both, maybe, or maybe not yet, or neither for some of you. And maybe you actually haven't even stopped to think about it, but now you are and have a little bit of hindsight saying, whoa, maybe there was something going on there that explains it a little different than what I thought. So, what did we find out? Both. Not surprising. Personally, professionally, and neither yet. But both, like I said, not surprising. We don't leave our symptoms at the door when we go to work, and vice versa. Uh, we're that whole person, and uh, and it impacts us. Thank you for sharing that. Ah, where's my clicker there? So these are the reports that you can find on the Menopause Foundation, and we have a link at the end of this slide here, but you can easily go onto the website and take a look at the reports for yourself. They were, the work that the Menopause Foundation has done over the last, I think it's about 3 or 4 years now, is phenomenal in terms of their research and uh, and what they've been able to bring to light. Okay. They are a nonprofit advocacy organization created to raise awareness of the impact of menopause on women and society. Their mission is to eliminate social stigma and taboos associated with menopause. They're dedicated to closing the menopause knowledge gap, improving access to menopause care, and creating menopause inclusive workplaces. These are groundbreaking reports. They didn't exist anything like it in Canada before. And it talks about the women's experience in menopause in the workplace and the steep toll of silence and stigma on Canadian women as they go through menopause. So I encourage you to take a look at the website. They have a number of resources that we'll look at one of them later on. But they have a list of menopause friendly doctors, doctors who are specialized in that area. They have checklists that take a look at those symptoms that you can use to help you have a conversation with your practitioner as well. So just a number of different resources and tools. So a little bit more about numbers and the stigma. So 2/3 of those interviewed said they would not feel comfortable speaking to their supervisor about their symptoms. And I can understand that. And we'll look later on when the nurses' comments about where some of that might come from. 70% said they would not feel comfortable speaking with HR about their symptoms. And 48% would be embarrassed to ask for support that might make a difference. And I think a lot of the time people don't know what even to ask for or how to begin. We know our jobs and we go and we do it. And and we often don't think about how we could do it differently. And I know there's a number of my colleagues in disability management online, and I mean that's a primary role of a disability management professional is to help workers understand how they might be able to do things differently and work with you and work with the supervisor or the manager and the in HR to figure out a way to do things slightly different. So within Canada's 20 million person labor market, people who are working, 5 million are women over the age of 40. So the Menopause Foundation research indicated that the majority of women, like I said, would not feel comfortable speaking to their HR departments or their supervisor or feeling that embarrassment. So you can start to see and think about the impact in the workplace, the impact to the individual, but the workplace, and start to think a little bit bigger about the economy and and how many people this is. Okay, many of the women are hiding their symptoms at work and believe the symptoms negatively impact their performance and progression in their workplace. So again, you're starting to think about the real impact here about people and women saying, if my performance is impacted, if am I able to look at a promotion? And self-doubt that comes in, our own fears, our, that anxiety starts to get up. You can see how it all comes together and the potential. So again, just some numbers in terms of the serious impact to individuals. And the staggering economic impact. And I know I have a hard time understanding, numbers of this big. This is economic data that was conducted by Deloitte Touche with using also some data from the UK and US. So it's from the Menopause Foundation. There is just a staggering economic impact uh, that that's out there because of unmanaged menopause symptoms. Okay. Reduction in hours and or pay or leaving the workforce altogether, unpaid sick, reduced hours. So I switch to part-time or casual because I'm not able to maintain on a regular basis, which reduces your income, reduces your pension potentially down the road. Not taking a promotion. You think about with those of us who have a pension in your best 5 years are usually in your later years and during this time. And if you're cutting back your income, the ramifications down the road are significant. Um, but it's about lost productivity. Uh, and I think there's a comment it's on a different slide about 540,000 lost days of work were attributed to menopause symptom management. And so you just think about your own world and maybe, every month, if depending on what it's like for you or your unpredictable periods or flow or severity or not sleeping and fatigue, and it's beyond fatigue, it's the insomnia and the inability to even get up and think, and you're losing work because of that. It all adds up. And so, in the big picture, this is important to everyone. Um, I attended a conference last year with the Greater Vancouver Business Society board. Anyways, one of the presenters said, "You're all business people. This is the point you need to pay attention to. Symptoms aside, maybe all of that you're uncomfortable with, but as business leaders, you get this piece, right?" And it's true. All right, let's check in again. And this time we're going to shift, and I want you to think about your workplaces, your policies and procedures. Does your employer have policies or procedures in place that address menopause in the workplace? And maybe you don't know, maybe you do. Uh, but just something for you to start to think about. What would that look like? Um, Health and wellness policies, diversity inclusion policies. What do we have? No, so a lot or don't know. The vast majority of people don't know or they're or not aware or there isn't any. So not surprising. Um, but hey, that's something we're going to talk about a little bit later on. And I think going forward, this might be something you just check in with. Okay. Um, yeah, so all right, now we're going to get into a little bit more about BCNU and our research. So we've got some of that background. Um, and does it hold true for nurses in our industry? And so a little bit about us in BC. The BC Nurses Union represents over 50,000 unionized nurses. More than 90% of nurses in Canada are women, and that would hold true for us as well. And more than 50% of nurses in Canada are over the age of 40. So you start to think about uh, people at that age are, we're at our peak, we're at our most probably knowledgeable, we're experienced, and that's a lot of workers who, without them being present, it will significantly impact the ability to provide healthcare. And I don't, there's comparatives as well. I think maybe not quite the same numbers, but I think about education in BC and the BCTF. Again, a large percentage of women, a number of percentage are older, in their mid careers. Um, and so think again about your own industry. And maybe it's not the same, but you're thinking about, like I said, I come back to construction. Um, and and that is a growing industry for women. Retail, social works, any kind of community work. So what we did with the Menopause Foundation and with the research company Leger, we held an initial webinar about introducing it. So quite similar to this and what Janet Coe had presented to our disability management group, just raising awareness about what menopause is and the impact of menopause in the workplace. And we did this all very quickly, we had 400 people register for that day for a noon session in August. We were just blown away by that. Following that, we had two virtual focus groups that Leger facilitated and ended up with 14 nurses who participated. They were across the province in different nursing roles, community, long-term care, and acute care. And the criteria was that they are experiencing or have experienced menopause or menopause. So those were the groups. Nurses identified four characteristics of nursing work that make it challenging to manage menopause symptoms. One of them was workplace culture. Um, there is an established norm that you carry on with your job no matter what, right? You're putting the patient first. There's the physical and emotional demands of the job. Working on the front lines requires standing for long hours, 12 hours often. You're working often with breaks or minimal breaks. Nurses are expected to be present, to present as calm and collected, right? We have to maintain this air of control and support, which is difficult if you're experiencing a lot of uncomfortable symptoms or haven't slept, right? Dealing with that fatigue. Scheduling and shift work, again, 12 hours, often day-night rotations. If you're in acute care or long-term care, you might be doing 8 hours, but a day evening, a day night. Um, and so physically and very emotionally demanding. And there's a barrier to be able to practice habits that help alleviate the menopause symptoms. So that's the other piece. So that general wellness about being able to eat regularly, have regular exercise, good sleep habits. Well, that's all interrupted when you're working shift work. So again, whether you're nursing, whether you're first responders, or in other industries that are shift, working in a warehouse, um, those types of things impact your ability to manage symptoms. And certainly for nursing and probably other professions as well, staffing and the shortage of nursing. And I think that's a key piece that impacts a couple of different ways. First off, nurses feel pressured to take on more, work an extra day, work. If you're working an 8, you're staying for another 4. Work without adequate staffing or coverage for breaks or shifts, of which the patient care suffers, and that just compounds all of those factors. So these were things that came out quite significant. I'm going to share some quotes with you from the nurses because I think they're powerful and relatable. And I think, like I said, whatever industry you're in, or if you're supporting individuals, these are things you might think about. There's a couple of higher tier positions open right now, but I'm too afraid to apply for them because I feel like I don't have the on my gameness. I have so much experience. I just feel like I don't know if I'd be able to do it. So nurses share powerful stories about managing symptoms. And again, if you have a hot flash, suck it up, princess. I don't know how many times I've heard that phrase, is the attitude I see and hear. Right? Or put your big girl panties on, or other things like, we don't have time to hear this. Um, uh, I guess I just wanted to bring back that piece around the average 7 symptoms. Right? So we don't even talk about the other ones. You're bleeding heavily. You wonder, is it showing? It was difficult. I was self-conscious. I think this one many people can relate to. And you might feel like, well, I have fairly good facilities at the office that I work at. It's about 2 years ago now, or 2 or 3, that the BC government legislated that construction sites with more than 20 people working needed to have a higher level of washroom facility. So that is not something I had considered, that access to washroom, an easy access to a washroom. So it's something I've taken for granted, but others don't have that. I think thinking about that, I think about that with retail and someone's ability to leave the floor, and use a facility. I have brain fog. I feel like I can't retain information as easily as I could before. I would like to ask for help to do fewer tasks at a time, but I just think our profession doesn't allow for that. You essentially have to be quiet. So again, uh, these are, whether you're an executive in a boardroom with organizational pressures, a teacher in front of a room full of students, bless you, police officers attending something, or retail. I think these can resonate with folks. The other piece that we heard about with nursing, and I don't know about other professions potentially, is nursing is a regulated profession. And so there was the additional concern about, will my license be impacted? If I have some brain fog, if I'm really fatigued because I haven't slept for 6 months and I make a mistake, am I going to be reported to the college and lose my license and my ability to work? So fear about that. And it's real. So, what are some solutions? Well, changes that they identified, we asked the nurses themselves. is the working conditions themselves. So is there a way to hire more staff? And more staff doesn't necessarily mean always more nurses. It means who is the best person for that job? Scheduling and shift flexibility, particularly as we're aging, retention strategies, creating more pathways for nurses to remain in the profession longer term, improvement to infrastructure to create more comfortable workplaces, the importance of education and awareness, importance of educating all in the workplace, so managers, supervisors, colleagues, those going through menopause, young colleagues, male colleagues. Education helps to reduce that stigma. And, whoops, sorry, uh, working to change the nursing culture, which is normalizing the conversations around menopause, having a conversation like this, building a workplace with some trust between employees and managers, and improving benefits. That's another area that we can look at. And it doesn't, again, it can mean um, what medications are covered. Is there hormone replacement therapy covered? What is your EFAP program? Do they have resources specific around menopause? Uh, so a variety of different aspects there. So this is a resource I wanted to share with you again. It's on the Menopause Foundation website. It's a playbook for employers. Anybody can read it, and everybody should read it if you're a disability management professional, a manager, a worker. It gives you some ideas about some basic things to consider. And it all aligns with things that we found that the nurses identified as well. So this has a 5-point action plan in it that addresses culture, communication, policies, accommodation, and employee benefits. So again, accommodation, menopause is not a disability, but the symptoms may be disabling and you may need to accommodate. And an example of that is in nursing. Somebody with an unpredictable flow and needs to be able to leave, then maybe they don't scrub into an operating room. Maybe they're the float nurse, the circulating nurse that can move about. They're not reducing their hours. They're not they're just shuffling the work a little bit, tweaking it so that for this period of time, they're they're able to leave if they need to go and deal with something. And that's just a simple little example of that one. It doesn't have to be big. It doesn't, but some of them maybe a little bit more. Maybe for individual really suffering with mental health and insomnia, they might need a more regular schedule to create a sleep cycle that allows them to deal with their conditions and stabilize for a period of time. Maybe that means no nights. So this, like I said, can be used by anyone to take a look and see what are some solutions. It's all about listening. It's all about learning and acting, as they say. So as we're kind of winding up here, I'd like to have you think now about what's an action you can take away from for today. Okay. As a result of today's session, what's one action you might consider taking? Is it sharing from today, learning? Is it maybe seeking out further education or resources, visiting the Menopause Foundation or other resources like the BC Women's Foundation website, reviewing specific workplace policies, now actually going back and looking at your health and wellness policies, looking at your benefit plan, having a conversation with a colleague or leadership, or maybe you're not sure yet. What's one thing? Maybe you go do them all, but just pick one. So, what do we know? What are folks thinking about? Excellent. Some sharing, some seeking further education. That's great. Looking at benefits and perfect. And having some more conversation. And that's okay. I'm not sure yet. That's okay too, right? This is the start of a conversation. And I think we all start somewhere and it's all about just doing one thing about that. And I had no plans of being here and doing this work. It's something that it just stumbled across, and so my goal is just to continue the conversation and invite others to do the same. Oh, we are at time for Q&A. I will put up the report here and a QR for the employer's handbook. But again, all of the information is on the Menopause Foundation website and easily accessible. I've actually just learned about the BC Women's Foundation website, and it's great as well. And they have some really good webinars that are recorded on on their website as well. So I think I will, I don't know if I stopped sharing or not. Hello out there. I am open to some questions, and we'll go from there.
If you can leave your screen up for a little bit, I think that's
Sure.
helpful as people might be taking the QR code or your email down.
Perfect.
Thank you.
Hi,
Yeah,
Lanny. So we've
hi.
received a couple of questions already that have come through.
Yeah.
One of the first questions was in regards to the economic impact. And the question was, do we have Canadian data or is this just UK and US data? I think I'd probably jump in and just say that it is based on Canadian
Yeah.
labour market data. The UK and the US were just used as comparators for sensitivity analysis. So it is all Deloitte did the work with the Canadian labour market data.
Thank you. That's absolutely right. For those of you who are interested, the UK, they certainly are ahead of us in their research around and action around menopause in the workplace. But so that's some interesting information there as well, if people are interested. But yeah, this is Canadian data, which made it very groundbreaking. Thank you.
Next question. Is there a plan to roll out education to GPs? I have found a shocking lack
Ah,
of knowledge in GPs of all ages.
I think you're right about that. I would concur with that. And it's interesting. I know the Menopause Foundation has done a lot of work with GPs and understanding they really don't receive education around this. So I think there's different work taking place in different ways, but I'm not sure about specifics around that education for healthcare or for physicians in terms of how they change their program or provide that education. The board, the foundation's board has physicians on it, and I think there is some work behind the scenes around that, but I'm actually not aware of anything specific. I would encourage people to, I've shared this information with my doctor and encourage people to do the same.
Another question, is there any good research about the impact of menopause on the musculoskeletal system?
Ah, there absolutely is. It's a little bit outside of my scope, but I would refer you to the uh, the BC Women's Foundation, which is associated with Women's Hospital, and take a look at their website for information. They have a number of their physicians. The research they do is available, and there is an excellent report called the She. What's it called, Marie? The She Report. Sorry, her.
BC.
Um, that was done by the BC Women's Foundation about a year and a half ago. It was released, and I would refer you to that. It's on their website, and um, it has more of that aspect. It also provides an economic impact study as well. It was done between an economist and the physicians at BC Women's. So you might find some information there. But it does, I would just say, because estrogen impacts and hormones impact our whole body, there is absolutely an impact around that, and there's information out there.
I am 61 and still having hot flashes. Will these ever stop? Bless you.
Oh, I hear you, sister. I hear you. You know what? I had that experience last night, and I'm the same age. So, will it ever stop? Oh, no, but I don't know. I should say that. Talk to my message to folks is about symptoms is to have a conversation with your doctor. There may be some solutions for you. Um, uh, Maybe this is oversharing, but there is vaginal creams that have some low estrogen that can just kind of take the edge off. So you have to make sure that it's appropriate for you. But those kind of conversations that are not invasive, from a perspective, health treatment perspective, but might be a solution. Talking about hormone replacement therapy, it's important to have the conversation if you're struggling with symptoms because there are solutions and the research is there. Um, and again, it's highly individuals, but I encourage you to have the conversation with your doctor. Don't just suffer through. There is solutions.
In a similar vein, I guess, any suggestions for women who are experiencing brain fog as a result of post-menopause?
Um, that's there. I think there are some tools. Um, I was just thinking about that before. There's something called the JDAPT, 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 which is a job demands accommodation tool. Um, you know, it's it's free. It's a Canadian design tool that you could walk through. You put it all in. You walk through your job examples of or maybe it's your home, you're looking at things. It gives you some solutions and some ideas. It's an accommodation tool. Um, my colleagues, my disability management folks, and even HR might be familiar with it. It's a brilliant tool to help individually look at how we can manage some of those brain fog tools. It might be readjusting what your work is and how you do it. But it takes that moment to sit back and kind of think, okay, how am I working differently now than I did before? It's not right or wrong. It's how am I doing things differently and how can I adjust or tweak things slightly? I can't multitask like I think I used to be able to do. And maybe I wasn't doing it well either, but I certainly can't do it now. And so I am much more methodical in outlining how I do my workday and making, spending my 20 minutes on something and then switching because I just can't manage like I used to. So I think DMs are really helpful in that way. And you don't have to be off work to have a conversation with a disability manager professionals, sorry. You can have a conversation. It's about keeping people at work and helping them stay at work. But they can also help you perhaps have a conversation with your supervisor in a supportive way as well. But again, it could be minor things like, you know what, I can't just have a conversation in the hallway now and remember it. I'll forget it by the time I'm down the hall. So you know what? I'm going to say that to you and let you know that. And can we come together and just sit in my office for a minute and I'll make sure I write that down. Right. So it's being creative, but I think actually women are very creative.
Has BCNU started to work towards supportive policies and around menopause to date?
BC&U, I would say, are you talking about BC&U in terms of supporting the nurses? I guess BCNU is an employer, so we remember that. And so, yes, I would say we are. Uh, we have 250 staff approximately. So, from internally, we're looking at our DEI policies. So, um, diversity and equity, we're looking at our health and safety policies. In terms of health and wellness programs, we're adding webinars. We've added some webinars around this. I've invited our staff to this. We're working with our EFAP providers around different webinars that are relevant. We're looking at our benefit packages and doing a review. And it doesn't necessarily mean we can change. the benefit plan right now, but we can look at what's already there. And what I'm finding in this role is a lot of people don't know what their benefits are actually until you start to do a deeper dive. So from internal and then but external as well. So if in the support that we're providing our 50,000 members, we're bargaining right now. I know that benefits are on the table and have been in discussion around the mental health benefits, hormone replacement, which is covered. Um, and so it's on the table for discussion and raising awareness around that. Um, and so looking at talking about, again, your EFAP, health authorities have some different EFAP programs. And so looking at what's available there. I'm going to mention something and now I've lost it, but so there are some different things taking place out there and importantly, conversations.
How come hormonal imbalances and menopause are not an occupational health and safety matter that is being addressed as a safety event in the workplace?
Oh, good, interesting question. Um, I think, when it comes to say that it, I come from a disability management perspective, and so it's about functionality. And so, how are we functioning, and what's safe or not? So, um, in terms, I'm trying to think of a situation here. So perhaps it's if fatigue and insomnia, and are you safe to drive a delivery vehicle or not? And I think that's a conversation that needs to take place. Like if I'm suffering from insomnia and I'm not sleeping um, and I'm a delivery person, can I be driving? Um, or is there something do I need to have that conversation because it is safety? I mean, workers have a responsibility to report unsafe, right? If they're unsafe, because safety is everyone's. But we have to be, I think where this comes into play is are we do we have an environment, a work environment where we feel safe speaking up to say, I don't think I can drive today? Or do we push it down, like the nurses have said, and do we push down our symptoms and our concerns about that, and we just do our job because we don't want to bring that attention or concern forward, or we think we're going to be negatively impacted. So it very much is a safety issue, or can be, depending on the symptoms and the functionality, how it impacts your ability to do your job. Um, so I think that's a big, big question. And trying to think that, and there's so many different variables to that piece, but it is absolutely for me, a part of health and wellness, a part of health and safety, because we're whole people and we bring that whole to our workplace. So,
Um, my GP refused to prescribe any hormone replacement. I had to wait for a referral to a OBGYN that who still refused to prescribe anything as I was not in full menopause as yet. Any advice for those in the grey area of perimenopause?
um, yeah, that is great. You know what? I'm going to refer you to the Menopause Foundation, and they do have a list of doctors who have special training and an interest, and to see if there is perhaps somebody else that you can speak to about that. Um, right? It's certainly, I mean, not knowing. It's about symptom management right now, right? I mean, that's really a key piece for you. And how do we work? How can they support you with that? Just saying no to that isn't for me a good enough response. What are some solutions that they can help to provide? So try the website, see if there's somebody else that you might be able to talk to, or um, and of course they would have to know the whole you about what's going on with you and other factors that might be at play.
I would definitely echo that. I think that website has some very good resources for doctors where people are kind of butting heads up against their own
Mhm.
family practitioner.
Yeah.
Um, are there any links between menopause and dysphagia?
Oh. I'm sorry, I don't know the answer to that question. Um, yeah, I'm sorry, I don't know
Mm.
at all. Drawn, yeah. Um, again, maybe I don't know if the BC Women's Foundation might have some information for you around that. I'm certainly not an expert in menopause, and by any means, again, my sense comes more from the disability management side and the functional side in that sense. But I but yeah, I think that's worth investigating and looking further into for yourself because it might open up treatment options or solutions for you.
What could incorporating menopause into workplace policies look like? If it's not a disability, how do we
Hmm.
incorporate it into DM policies or workplace accommodation for medical reason policies?
Right. Again, it comes down for me functionality. And so if the symptoms are not managed and are impacting someone's ability to do their job, then it comes down to that functionality. And there's a medical basis to it still. So well, menopause as a whole is not disabling. Again, the symptoms can be disabling. So it can still be managed through a temporary accommodation process as well, I think, from a DM perspective. Um, uh, like trying to think of some different examples for you there in terms of adjusting someone's work slightly. Just as somebody who it's not much different from somebody who has significant depression and anxiety just from a mental health condition. Um, and we may have to accommodate them to not be working night shifts for 6 months while they seek treatment and create a routine and a healthy sleep habit. Um, so whether those symptoms are caused because of a mental health disorder or because they're triggered and um, compounded by the menopause factor, they can still be treated the same way in that sense in terms of, again, functionality and how it all relates to the job demands and how do you tweak them, or adjust them or accommodate somebody.
We did have a comment about dysphagia. One of
Okay.
the attendees had experience of this, and she noticed that she had a year of investigation on breathing problems, including checks, X-rays, and ENT exams. And it turns out it was menopause related. It was a
Uh,
change to mucus, and it was a
uh,
naturopath. Which helped her with her breathing with supplements. So thank you for that comment.
oh, thank you so much. And actually that just reminds me, looking at benefits and things. Do you have other, what benefits do you have? Do you have access to a naturopath or other things? Uh, for looking at how things. I think the message for me is if you're struggling with symptoms, just keep advocating for yourself because you don't have to just suck it up, princess. Right?
Thank you, Lanny.
So,
There's no further questions, and we're
great
just at time
conversation.
almost. So thank you for the great questions.
Thank you, everyone, for your time and your conversation. And really, really thoughtful questions. Really appreciated that. And take care, everyone.